We turn to Vice Chair Nadeau. Now, as Representative Nadeau moves to the table, the chair moves House File 794 before the committee with the chair's intent to lay the bill over. Representative Nadeau, when you're ready, introduce your bill.
Thank you, Mr. Chair. I also have an amendment that I would like to move.
Okay, so moved. So Representative Nadeau offers the A1 amendment to get the bill in the shape that the author would like. All those in favor say aye.
Aye.
Aye. All those opposed say nay. The motion prevails and the A1 amendment is adopted. Okay, to the bill as adopted.
Thank you,
Or amended.
Thank you, Mr. Chair and members. Thanks for hearing this bill today. I'm bringing House File 794 today because every one of us knows someone whose life has been touched by dementia. A parent, a grandparent, neighbor, a friend. Over the past 5 years, the Minnesota Department of Health has estimated the number of Minnesota seniors living with Alzheimer's has increased by 20%, and the rates of adults experiencing cognitive decline are occurring at an even higher alarming rate. Alzheimer's is a disease that doesn't just impact the person who's diagnosed, it reshapes the lives of entire families. Those families are often left navigating a confusing maze of services and support with no clear path and no one to guide them on the process. Right now, there's no one in state government or county government or local government whose job is solely to focus on dementia, and families deserve better than that. They deserve someone who's paying attention, someone who understands a fuller picture, and work proactively to make sure that the programs that we currently have connect in a way that makes sense to the people they serve, eliminate redundancies, and make sure that our resources, both human and financial, are working in unison. This bill creates a single point of leadership within the Department of Health so that we can do a better job of supporting those living with dementia and the people that care for them. This isn't about growing government. It's about making government work better for the people who need it the most. I'm so grateful for the Alzheimer's Association for the work that they do on this issue, and I want to turn it over to my testifier right now to share more about the real impact this bipartisan bill can have for Minnesota families. And before I turn it over, I want to thank all the members on this committee that have signed on to this bill, Representative Bierman, Representative Schumacher, Representative Ryer, Representative Perryman, Representative Elkins, Representative Hemmingson-Yager, Zalesnikar, and Purcell. So thank you, Mr. Chair, and I'd like to turn it over to Mr. Freeman.
Thank you so much. Mr. Freeman, state your name and ask you to keep your comments to roughly 3 minutes.
I'll try and do that. Happy St. Patrick's Day, everyone. Good afternoon, Chair Backer and members of the committee. For the record, my name is Robert Freeman. I'm the Vice President of Public Policy for the Minnesota North Dakota chapter of the Alzheimer's Association. Our mission is to lead the way to end Alzheimer's disease and all other dementia by accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. Thank you so much for the opportunity to testify in support of House File 794, bipartisan legislation which would establish a dementia services program at the Minnesota Department of Health. Alzheimer's disease and other forms of dementia are one of the most complex and expensive public health challenges we face today. As you can see from the handout in the packets, more than 100,000 Minnesotans are currently living with dementia, and that number is growing rapidly. And we're spending about $1 billion a year on this disease just in Minnesota, which will affect 1 in 10 seniors. A study in The Lancet in 2020 suggested up to a third of dementia cases are preventable. Yet today there's no one single person within state government, as Representative Nadeau said, whose full-time job is to focus on reducing the incidence of dementia and providing services for those whose lives are currently impacted. This bill doesn't create a new program of bureaucracy, it creates clarity and coordination. Right now, dementia-related work is scattered across multiple departments, agencies, and community organizations, often with little or no communication between them. The result is inefficiency, duplication of efforts, and missed opportunities to better serve families and caregivers. A dedicated dementia programs manager will help connect those dots. This position will have a line of sight into the various programs and funding streams that touch dementia, ensure better coordination and smarter use of existing resources. And Minnesota wouldn't be alone in taking this step. 29 other states, red and blue, have already recognized the value of a dedicated point person on dementia. In other states, we've also seen these positions have been instrumental in leveraging federal and philanthropic dollars that can also help bolster communities' dementia services as well. We're behind, and this is a fiscally responsible step to take to catch up and make sure our public dollars are working as efficiently as possible to provide the best services for our constituents whose lives are impacted by dementia. I want to thank Representative Nadeau for his leadership for authoring this bipartisan legislation, and our other House authors who he listed, many of whom are in this room today. This bill is also supported by the long-term care associations, AARP, Catholic Charities, Minnesota Areas on Aging, Elder Justice, Lutheran Social Services, Minnesota Home Care Association, Volunteers of America, and numerous other organizations who work in this space to help elder Minnesotans. Please support House File 794 and help improve dementia services for Minnesotans. Thank you.
Thank you so much. Turn it over to the public. Anybody from the public would like to speak on behalf of this bill? Okay, seeing none, turning over to members' discussions. Questions for the author? Okay, wow. Oh, okay, Representative Bierman, go for it.
Thank you, Representative Nadeau, for bringing the bill forward, and Mr. Freeman for being here to testify on it. I was just wondering, could you comment on, like, if this funding goes through and you get the point person set up? I know there's talk about outreach and so forth in the bill, but what are some of the, top line priorities you would see would be most effective using this funding?
Yeah, that's a great question.
Mr. Freeman,
Oh, sorry.
go ahead.
Sorry, Mr. Chair.
That's okay.
That's a great question, and I know that the folks from the Department of Health are here today too if you have more technical questions. So I think some of the things that we see are really just having line of sight into those different organizations and in the community around the state that are working on these issues but might not necessarily be talking to each other. So for instance, let's say an organization in Apple Valley wants to create an organization to help people with Alzheimer's disease, and they say we should set up a helpline. And the Alzheimer's Association already has a helpline, so we wouldn't want to duplicate that. We could use that money for something else more valuable. But also, as we kind of enter kind of the era of treatment with Alzheimer's, and we have, now we have FDA-approved medications that can help slow down the progress, we're also going to want to work more closely with our healthcare systems to make people aware of those and make sure that folks are, getting access to that treatment as well. And then there are, I think, other opportunities that have been identified in the Department of Health's, Healthy Brain initiative plan to address Alzheimer's and dementia too, and some of the inconsistencies and difficulties that have been in communicating between the different parts of state government.
Okay, follow-up?
Yes, please. So, I think about Alzheimer's and I meet people who are struggling with that in their home with their loved ones, and they're not really connected to anything else. And so I think that building that connection, and it's also, as we've talked in the past, it's sort of a stigma, and people try to almost hide it to some level. And I think that's going to be a challenge going forward to kind of get people the support they need when they need it, and it can make a world of difference for the patient and the caregivers. So I appreciate the bill. Thank you, Representative Nadeau, for carrying it forward. I just think, as you mentioned in your statement, this is something that's it's just going to be more numbers going ahead. So thank you both.
Okay, seeing no further discussion from members, Vice Chair Nadeau, please close on your bill.
Thank you, Mr. Chair and members, and thank you, Representative Bierman. Minnesota put together a strategic plan to address dementia in 2022, and I see this position as being one that can start implementing those. And families that have lived with families that have lived with people with Alzheimer's, is the trajectory of that decline is difficult to pay attention to and to know what comes next. And I think that this position is going to really do a lot to help those families kind of know what's ahead as families lose the resources of the parents. and they move into MA, and they move into higher levels of services. There's so many people that just don't understand that trajectory. So I really thank you for supporting this bill.
Okay, thank you so much. Thank you. The chair lays over House File 794 as amended for possible inclusion in the omnibus bill. Thank you, Vice Chair Nadeau and Mr. Freeman.